I'm here at the studios of KALW in San Francisco with Wendell Potter. Wendell spent 20 years working as a senior public relations executive for two of the largest for-profit health insurance companies in the U.S., Humana and CIGNA. In 2008, Wendell's conscience got the best of him, and he left his job as head of corporate communications for CIGNA, and he's now exposing and speaking out against the very practices he once defended. You can read all about his story in his new book, Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. So, Wendell, you say that it's very important to focus on the fact that just because the healthcare bill passed, the spin has not stopped.
Right.
Can you talk about that?
It absolutely has not stopped. The legislation does a lot that insurers like. It will require us to buy insurance from them as in a few years down the road, and it does not include a public option, which they did not want. But it has a lot of consumer protections in it, and they don't like that. They'd like to strip out the new regulations, the new prohibitions on them. It makes illegal a lot of the things, a lot of the practices that should have been made illegal a long time ago. They don't like that, so they will be working to try to get this new Congress to take out some of the consumer protections and leave in the things that they like that are not going to be so good for us. So the implementation of this bill also is something we have to watch. It's not something the media watches over very much. They were covering the debate on reform in Congress, but they don't find it of great interest to see how the Department of Health and Human Services or the state insurance regulators are going to actually implement this bill. And
the media, the corporate media especially, do a very bad job of exposing these front groups. Yeah. Because in your book, you write about how you often hired APCO Worldwide and Porter Novelli to do whatever it takes to win. And these are two of the most influential PR firms in the country. APCO set up Healthcare America to basically spin Michael Moore's Sicko film. And you say that not a single reporter did the investigative work to find out that insurers had provided most of the funding to set up Healthcare America.
Not a single reporter did it, and some of the most prestigious newspapers in the country quoted people purportedly with that organization. It was a shell organization that had a fake address in Washington, and I went to there just to make sure that it didn't really exist as a corporation, and no reporter did the work to disclose that. It was just astonishing how easy it is for people like me to get away with what we used to do and still do.
And also, Healthcare America was quoted in the New York Times, yes, one of their, quote, executives saying that, yes, this healthcare bill is socialism.
Exactly. And the New York Times gave them that opportunity to do that and gave them legitimacy, when if they had looked closely, the person who was listed as the PR contact, the media contact for that organization, worked for APCO. And it was created by APCO, run out of APCO, and the spokesman was for an employee of APCO.
So a simple Google search would have given you that information.
Yeah, and you can do it today. They've taken down a lot of the information about Healthcare America, but you can find quite a bit about it.
How do you explain this? Because you also write in your book that I believe it was Edelman a few years ago, they launched a campaign about this road trip that a couple, yes, decided to take, and they stopped in the parking lots of Walmarts across, yeah, the country. And isn't Walmart so incredible? Well, it was exposed that this was actually a PR ploy. Yeah. Yet, you say that Edelman walked away from this unscathed.
They did. And I've also recently revealed in some of my recent blogs some of the other things that Edelman did. And they're trying to make us think that they didn't do them, or there was never very much awareness that they were doing in the first place. But they carried out some of the most incredible public relations campaigns for the tobacco industry to try to make us think that tobacco smoking was of no consequence to us, and ultimately later that secondhand smoke was no problem. These folks do some very evil work.
You used to be a journalist, used to be now a PR executive. We as journalists are supposed to expose this information, and it's not that hard to find. Why is it so rare?
Because it's kind of, I call this invisible persuasion, and even most reporters don't really know what goes on inside the PR profession. It can be used for good, and I state that in this book. I'm not condemning the entire profession. I think there are a lot of people who do good work trying to communicate with the public, which is the right way to do PR. But most people just have no clue, and that's why I wrote the book.
Well, you say that the book is as much about public relations as it is about healthcare, because until the public understands spin and manipulation, we're not going to move forward on so many of these important issues.
Not only are we not going to move forward, we're going to be losing our democracy. It's that serious, because you're seeing a great imbalance. You're seeing that we have far fewer reporters than we used to have, far more PR people working for huge corporations, and we're in danger of losing our democracy and replacing it with a plutocracy.
Now, as head of corporate PR for CIGNA, just to let people know the job that you had there, if I as a reporter wanted to interview your CEO, I had to go through you first.
You did.
And once I got there, if I got there, you were in the room with him.
Absolutely.
You told him what to say.
Yep.
So you were up there.
Oh, I was up there. He would never talk to a reporter. I probably would have gotten fired if I had even attempted for him to talk to a reporter with me not by his side, because I had to monitor the conversation. I would never let a reporter talk to him that I didn't feel would be friendly toward him in the first place.
And you also wrote the talking points that we all hear, those of us at least who watch the cable shows and listen to talk radio. You wrote the talking points that the politicians and some quote-unquote media figures repeat endlessly, whether it's Obamacare, government takeover of healthcare, or socialism.
That's right. And your premium dollars and mine went into this work. A lot of the money that we spend in premiums is used to test messaging, to do the linguistic research into what works and what will scare people. What we're talking about here is really fear-mongering and then ultimately anger-mongering. It's why we saw so many people being angry about healthcare reform and people voting against their own self-interest as a consequence.
Can you talk just quickly about the dissemination process? You get together with your executives and you say, all right, and this is nothing new because it happened during Clinton and even before that, these buzzwords. But how do you, once you have, say, a 10-page document of these talking points, how do you disseminate them?
It depends on the audience. If you're trying to get them to lawmakers, you use your lobbyists. You print them out and they just hand them out on Capitol Hill. It's that simple. And you do it fairly discreetly, and often it's to staff members. You don't necessarily hand it to a member of Congress, but you develop also very good relationships with staff members. That's key. We're talking about money, relationships, and they're all important, and ideology. The other thing is that to get it into the media, you cultivate good relationships with producers and reporters so that they're going to be receptive when you have your talking points handy to give to them, to pass along to the pundits and the so-called journalists on some of these networks.
So then these politicians go on MSNBC or CNN or obviously Fox and just repeat the same thing over and over and over again.
And that's an important part of the strategy. It has to be simple, it has to be catchy, it has to be memorable, and you have to say it over and over and over again. And if you hear it often enough, you think it's true. That's why people, even yet today, think that the legislation has created death panels that's going to kill our grandparents. Obviously, it never had anything approaching that kind of a provision in it. And people think that this legislation, many of them, is a government takeover of the healthcare system, when in reality, it props up a private healthcare system. It guarantees that these private insurance companies are going to be profitable for years and years to come. It will require us to buy their products, and it doesn't include a public option, which we really needed to have.
But it works brilliantly because you have people, I was just on vacation, I met people from Canada, Australia, and obviously the United States who spewed these talking points that we're leaving Canada because the U.S. has the best health care in the world. This is socialism. This is Obamacare. It was incredible. And then we also, on today's radio show, heard from one of our KALW reporters who said a woman in line at the food bank who desperately needs health care said it's socialism.
It's extraordinarily successful when you're undertaking something like this. You spend a lot of money doing it, but you keep doing it over and over again, years and years. These terms are not were not invented just for this debate. They've been going on for years and years and years, and they're evergreen, I call them, and they're extraordinarily successful.
We're speaking with Wendell Potter, former corporate communications executive at CIGNA, author of the new book, Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. And we'll spend in part two just a couple of minutes talking about why Wendell had a change of heart.